Good afternoon, everyone. Thank you for joining us today. I am Gemma Farina. For those of you that don't know, I am the Managing Director of GFHR Consulting. As you may know, we support small businesses with their HR needs. We're very people focused, and we want to help employers look after their teams in a way that feels realistic and sustainable. Today we're focusing on employee benefits. So we talk about this a lot with our clients, and specifically we're going to talk about health cash plans. We're seeing a growing interest from some of our clients about how we can support people in the workplace, and what things we can do to support employee retention, in a way that is then cost effective and easy to manage. So this session is all about giving you a clear, practical understanding of how health cash plans work, and whether they could be a good addition to your benefits within your organisation. I'm delighted to be joined by Charlie Webb from benefits broker BDHL. Charlie is going to be working or works closely with SMEs to help them put together benefits packages in a practical, no-nonsense way. So he's going to talk to us about health cash plans and how they work, and how we can then put them into your business. But before we go on to that, I just want to talk a bit about why benefits are becoming more important, and how they can help small and medium businesses. So, as we all know, recruitment is getting more and more difficult. Having the benefits in place to be able to entice people and engage and retain, is with rising pressures on employees' health and finances, is putting more pressure on businesses to look at what they can do differently. We've got changing expectations around employer support. Employees are expecting more from their businesses, and there's been a real focus on well-being, certainly over the last 6 years. So finding the right balance really matters. It can't always be about increasing salaries. So looking at benefits can be a more cost-effective way of offering resources for your teams. With benefits, there is no one size fits all approach. It's all about flexible working, family friendly policies, giving them opportunities around learning and development to help increase motivation, and obviously wellbeing initiatives and mental health support. Looking at financial well-being, people are really concerned in today's market with the kind of cost increases and rising inflation, puts pressure on everyone. So looking at benefits that support not just us in the workplace, but outside of the workplace can be a really easy way to show your commitment to your employees. Health cash plans stand out because they're different. They're simple and easy for employees to understand, and they offer tangible benefits. I didn't realise until I kind of started looking into this a little bit more. Fortunate to have had a back plan for a while, and didn't actually realise how much benefit you actually get from it. And then had a conversation with Charlie, and Charlie said, "Have you done this, that, and the other?" And I said, "I haven't." And I've recently cashed in on that and managed to get a pair of glasses paid for. So with no cost or minimal cost to me. So it's a really good way to be able to support your employees and make them feel that they've got that little bit of extra value and get a bit more back. So on that note, I'm going to pass over to Charlie, and Charlie can talk to us about why cashback plans matter.
Lovely. Thank you very much indeed, Gemma, and thank you for giving me the opportunity to join the webinar today. So just to give a brief introduction, my name's Charlie from BDHL. We're a health and wellbeing insurance broker based in the heart of Tunbridge Wells. We specialise in multiple different services, as I say, mainly health and wellbeing related, from your private medical insurance and cash plans to life, income protection, key person policies, and so on. So today the discussion is going to revolve solely around healthcare cash plans. And as per the first slide, you can see there, what is a cash plan? So, a healthcare cash plan is a practical, cost-effective benefit that supports the everyday health needs of one's workforce. The policy reimburses the employee, provided it's within their annual allowance, which I'll touch on further down this presentation, for the cost of the more everyday health expenses for both physical and mental health appointments. So everyone's very familiar, I'm sure, with private medical insurance, the fact that it covers the initial up to the point of diagnosis, and after that, there's also cover for the treatment. We like to say that a cash plan is a cost-effective alternative, by no means a replacement, but it focuses more so on the preventative treatments and the more day-to-day health expenses, which I will go through further through the presentation. Gemma, if we could go to the next slide, please, that'd be great.
Do I jump through too? Yeah.
Yeah, wonderful. So, firstly, of course, there's a benefit to having the cash plan for the employees, but furthermore, there isn't a benefit to the employer. As Jim has said in an introduction, it's key to be retaining the best talent and, of course, attracting new talent. The fact that anyone even has an employee benefit, it's not just salaries these days, that straight away looks attractive. The fact that you as an employer having something in place, such as a cash plan that can enable people to have their sort of annual or biannual routine dental checkups, an annual eye assessment. You're putting a tick in the box as an employer, particularly if you have a workforce that use screens every day. You have a duty to provide an annual eye assessment. You give them the cash plan. There's a benefit on there for it. Whether they use it for that or not is down to them, but you've put a tick in the box there. So a cash plan is more so surrounding the prevention is better than cure. The main benefit of a cash plan is, in comparison to private medical, you don't have to be sick to use it. And that's one of the frustrating things people do have with private medical, which also includes quite high premiums, is the fact that it's very reactive. The whole purpose of a cash plan is you don't need to be sick, you look after your health. And when you look at the cost, particularly in comparison to the more expensive benefits, you'll see that the return on investment in these policies is very good indeed. And it always leaves people scratching their heads with, well, how do these people make money? Really, these cash plan providers are hoping that people forget they have it in place and don't use it. That's why we're here to try and boost engagement and educate people on this product and how to get the most out of it. If we go to the next slide, please, Gemma. Wonderful. It's very, very simple. It is a cashback policy. You would book your own appointment, and let's use an example of a routine dental checkup. You book the appointment yourself, you pay for the appointment yourself, but you keep a copy of the invoice and receipt. All of these providers, of which we have around 8 on our panel, have a very easy to use application whereby you sign in, there'll be a tab saying make a claim, you fill out a few fields, date of treatment, the cost of the treatment, the type of the treatment, upload a copy of your receipt, and they will reimburse you accordingly. Now, the market typically say it takes around 5 days to seek reimbursement, 5 working days. Really and truly, it's most commonly settled within 3, if not less. I myself had a routine dental checkup on Tuesday last week. The money was back in my account by Thursday. So it is an extremely straightforward process. And of course, it's something that the insurer and us as BDHL would be more than happy to have an opening discussion with the workforce just to tell them how to use the plan and how to get the most out of it. We go to the next slide, please. Lovely. So the burning question, how much does a cash plan cost? And this might surprise people. So policies start as low as £7 per employee per month. Within each policy, there are a variety of different levels of cover to choose from. And also children are typically included free of charge. Now, normally you can have up to 4 dependent children on there, no additional cost. Some let you have an unlimited number of children. The children will either get their own benefit allowances, or they would share one allowance between all of them. But what I've done here is taken a snippet from one of our providers' sort of 4 tiers of cover. So you can see here from the photograph that we have on the left, dental, optical, physiotherapy, chiropody. There are a number of benefits included. And to the right, you will see the allowances of which everyone's covered for per year. So as an example, level 1, you'd have £65 to put towards dental. Now that will be sort of your routine checkups, it could be restorative treatment, it could be a emergency treatment. You then have optical eye examinations, cashback for prescription glasses and contact lenses, a host of added benefits such as therapies, and something that I'm sure will be no surprise is quite a utilised benefit is the virtual GP. We're easily waiting weeks to get a GP appointment these days. With a cash plan, you have unlimited 24/7 access to a virtual GP. If said GP wants to make an onward referral, that too would be acceptable. So a cash plan is great because it bridges the gap between if you have private healthcare, fantastic, you can get your diagnosis quickly and get into treatment even quicker. If you don't, you see your NHS GP, he might say, I want you to do a form of diagnostic test. You could be waiting weeks, if not months, for that in the NHS. With the cash plan, you can utilize the diagnostic benefits, take that referral, and go straight privately and claim back the costs. There are also a number of ancillary benefits which come alongside a cash plan. Typically, you're always going to see a gym discount benefit. So the names we tend to see are Nuffield, David Lloyd, and some providers also have a number of independent gyms. There are also access to online discounts and rewards on a variety of services. There is face-to-face counselling sessions, a 24/7 helpline. There is a lot that is included on this. Health Shield, as an example, will have something called Skin Vision. Now, this is an app whereby if you have a lesion on your skin, a mole or a spot, and you're a bit concerned about it, you can quite simply load the app up. You take a photo, it goes through some form of an AI generated interface, which is beyond my pay grade. I don't know how that stuff works, but it will tell you if that is something that should be investigated further or if it's likely to be nothing to worry about. So again, it all comes back to that prevention is better than cure. It's about sort of noting these things early on and getting into that treatment pathway as soon as possible. So yes, as I say, £7 per employee per month. With this particular provider, Health Shield, I think it's about £6.80. There is a product on the market that's as low as £4 per employee per month. Could we go to the next slide, please? Thank you very much. So usually the setup of the cash plan is the employer would look to offer a company paid level for all. So for ease, let's say the employer says, I will pay for level one for all of the employees on the scheme, children typically included free of charge. Now, if we have employees on there who want to add their partners or may think, I want to upgrade to level two, they can certainly do that voluntarily. There are two ways they can do that. It can either be by salary deduct. So the employee would tell the employer, I wish to upgrade to level two. Let us know. We deal with the upgrade. The company pay for the cost of that upgrade, but then they retrieve the upgrade pricing from the monthly salary. What tends to be more preferred is a direct debit agreement. So certain insurers will instead say, these are the voluntary upgrade prices. Communicate this out to your staff. If they wish to upgrade, there's a form, a one-page form they need to fill out, send it back to us. They have a direct arrangement with the insurer to pay for the upgrade themselves. So from a HR perspective, it's great because they've got to, they avoid having to seek reimbursement from salaries. It's all done directly between the employee and the insurer. So again, as I say, children free of charge, upgrade to include your partner or spouse, and or upgrade your level of cover as well. Could we have the next slide, please?
Of course.
Wonderful. So the process of getting quotes and for us to go to market is quite straightforward, particularly in comparison to something more convoluted than private medical insurance. But with the cash plan, our first port of call would be to have an initial discussion with the employer to just gain a better understanding of their demands and needs and their current circumstance. It may be a case where they already have a cash plan in place and they're just simply looking to see if there is a better alternative out there for them that will save them some money, but without negating the cover. So it's all about having that initial discussion just to understand your requirements. For us to then go to the market to get the quotations, we would send over a census list to be filled in. Really and truly, to get the quotes, all we need is the number of employees and the gender split. Names are going to be required if one decides to actually on board with the policy, but for quoting purposes, We don't need to know that. We just need the numbers and the gender split. We will then go out to tender and we work with all of the providers in the marketplace, of which there are eight. Um, and then based on the initial discussion we have had, we will tailor that market review accordingly. Once we've collated the quotations back from the market, everything gets compiled into a report whereby we just recap on your demands and needs. We provide a price comparison of all of the insurers we've quoted, as well as a benefit comparison. So you can see where one insurer is better than the other with the likes of dental or therapies or diagnostics and so on. So we would then suggest having a follow-up call once one's had time to digest the report, just to understand any feedback you may have. If it's a case whereby you wish to proceed, it's very straightforward on board a cash plan product. We'd finalise the membership, noting that when we first went to market, you may have had some new employees join, you may have had employees leave. So we just finalise who's going to be on there as of the enrolment date. There's quite a straightforward form, a direct debit mandate, and we do everything else to get the policy all set up. Furthermore, us as BDHL or GFHR, and we could even get the insurer on board as well, would also welcome a conversation with the workforce, or indeed just the employer if that's what they wish, just to go over how the plan works, how to submit claims, how to track benefit allowances, how to add and remove people throughout the year, so on and so forth. So it is really a hand-holding process you would receive just to help you sort of mitigate all of the issues that can sort of crop up with the unknown.
And I'm right in saying, Charlie, there's no cost for getting the quote, is there?
There's not, no, absolutely bang on. So there is no cost for our services. We offer free market reviews. The administration throughout the year, there's no fee for that as well. And equally, I know that there are some brokers that may tie people in for a certain number of years in a contract. We don't do that either. So you get the offer of an annual market review. And as I say, admin, so joiners, leavers, address changes, so on and so forth. We will deal with all of that for you. And something I didn't touch on with the cash plan, just going through the benefits. Pre-existing conditions are covered with a cash plan, and people who are familiar with private medical, I'm sure that is somewhat of a gripe for them, whereby it covers newly diagnosed acute conditions only. Cash plan, that's not the case. You can access those benefits from day one, no waiting periods, no restrictions on pre-existing conditions.
That's great.
All
Do you
right.
want to move on?
Yes, please. Wonderful. So I think this might be the final slide. Renewing a cash plan. So as I've touched on, the administration, the offer of an annual market review, that all falls within our service. We offer ongoing support throughout the year. Prior to the renewal, we tend to get renewal terms of cash plans quite early, around about 3 months. We will get in touch with you to prompt a pre-renewal discussion, find out how the last 12 months has been, if there has been any pain points, if you're looking to decrease the cost or introduce some new elements of cover. We will go all through all of that with you. Depending on the outcome of the discussion, we'll either aim to achieve the best rate possible with the holding provider. So it may be a case where your renewals come through, the provider is holding their rates, no increase, the same monthly price per head sticks. You may think, well, look, we're happy just to continue as we are. I would still suggest, let us go to market, let us see what terms we can get elsewhere. If it is a case whereby you're quite happy to stay where you are, another part of our service is negotiating with the holding insurer to get the best deal possible for you. So if there is an option of switching elsewhere for a premium saving, we will quite simply have a conversation with the insurer to try and get the best premium. I think that might be it, Gemma. Is there one more slide?
I'm not sure. No, that's on to me. I was just about to say, Charlie, so as the employer, you get a report to see how much usage people are actually making of it as well. Because I think that's the thing. You don't necessarily, as an employer,
Yeah.
you've got to also promote that benefit so that people can see that it's there. And so I think if you get to the end of a year and the usage hasn't been quite as much as you might expect, then it's about working with us as the HR consultant to say, put it back out to the team, and perhaps then you guys coming in and having a further follow-up discussion to say, hey, look, you've got this benefit and this is what,
Mhm.
you could have actually claimed over the course of the year. Because I guess just because you claim on dental doesn't mean you can't also claim you can claim on all of those categories, can't you? You can't
Absolutely.
just
Yeah,
go, right,
absolutely.
I've had dental, therefore I can't get anything else.
No,
You
certainly.
get
Yeah, yeah. So all
everything.
the benefit limits are in accordance to the benefit you see there.
Yeah,
So if you exceed all your dental, you can still use the physio, the optical, diagnostics, and so on. And as you said, you will get claims management information. That is highly dependent on the size of the scheme because of data protection and GDPR and all of that fun stuff. The insurers have got to be very careful. If you have a group of 5 people,
yeah,
if they're giving you management information telling you what's being claimed the most, it can be argued that we have the question of anti-selection there. The employer could think, not saying they would do this, that person is what, ramping up the premium on our policy due to claims, we'll remove them. So they've got to be quite careful when they
yeah,
share
of course.
data. But it is certainly something that a lot of insurers do offer. And something I didn't mention is the product I showed from Health Shield with the 4 tiers of cover, that's an off-the-shelf product. And all of the providers in the market will have an off-the-shelf product where the cover levels and premiums are set. If you are a fairly large scheme, typically 50 plus employees, you can actually tailor the benefits to suit exactly what you're looking for. So you might think, well, no, we want £200 for dental, but we don't need £100 for optical. We'll lose a bit of that. That's
Yeah.
fine. We can add, remove, reduce, increase benefits across the whole plan. So it is very flexible.
Yeah, I think the other thing that I know you touched on was the rewards that come from that. So the discounts that you get, and I know you mentioned the gym, but it's literally discounts off can be discounts from shops and all
Oh
sorts
yeah.
on it as well. So vouchers for eating out and things like that.
This is it. And it comes back to the return on investment.
Yeah,
And really, I mean, £7 per employee per month, just using that example, when you see the cash allowances one can reap, and furthermore, as you say, all the discounts that you can get as well at any point throughout the year, straight away, I mean, it does bring the question of how do these people make money? Because if you
yeah,
use it to how it should be used, you're going to get way more for your money.
yeah,
So I'm a massive advocate of it, and yeah, we see a large uplift in cash plans as of recent as well because of the low cost.
yeah.
As I say, the return on investment.
Yeah, absolutely, absolutely. Yeah, I think they work really well, particularly, looking at your HR strategy and how you're rewarding your teams,
Mm,
and looking at as a wider joined up, what can we do to support our employees to make life easier? And, as a business, salary increases can be quite costly to keep up with inflation, but actually that £7 per employee is a minimal cost
yeah.
for an employee to then get quite a lot of benefit if you are using the system, and actually that can all add up over the course of the year. So I think it's definitely a good thing for small businesses to be able to offer. But
Absolutely.
they're not going to replace um, good people management. You've still got to have kind of your HR in place, but if you're a business that's focused on your employees and focused on well-being, looking after your teams, it can absolutely enhance that. And I think what's really important is at this stage, it's just about potentially having that conversation and looking at what you can do. And as you've said, getting a quote doesn't cost a business anything. So kind of why wouldn't you go out and just get a quote and get that understanding of, is it something that we could afford for our business that is going to make a difference and going to add to our offering as an employer to help our retention and recruitment?
Yeah, absolutely. I think if you spoke to a company who have several employee benefits in place, let's talk sort of health and well-being related only here.
Yeah,
We as a business, for example, we have the private medical, the cash plan, dental, so on and so forth. I think if you ask the majority of the staff what benefits do you like the most, it will be the cash plan because we all go to the dentist once or twice a year. So
yeah,
it's a tangible benefit, as you say, and you're always going to get something out of it. And for the cost, it can be somewhat of a no-brainer.
yeah.
And as you say, particularly from our point of view, we do these market reviews free. So yeah, absolutely, do get in touch. We'd be more than happy to look at this for you.
Excellent. Okay. So next steps is to kind of look at what your employees value, I guess, and what your current offering is in terms of benefits, and your wellbeing support, and then think about get in touch with us and we can have a conversation with Charlie on your behalf, or we can have a conversation with the three of us to look at whether cash plans can add value to your business. So hopefully you've enjoyed the session. Hopefully you've learned something about cash plans. Huge thank you to Charlie for joining us today and sharing that information. If you have got any questions, please let us know. We're very happy to take them. If you come through to us at the team at GFHR, we can liaise directly with Charlie and get those questions answered for you. Equally, if you'd like to arrange a meeting and we can talk a bit more, get a quote for cash plans, then absolutely get in touch with us and we'd be happy to help. Thank
Perfect.
you.
Thank you very much, everyone.